So today we'll be discussing about radial nerve. So radial nerve origin, it is a continuation of posterior cord of brachial plexus, largest branch of brachial plexus, root value is C5, C6, C7, C8, T1. Course and relations, descends behind third part of axillary artery and proximal part of brachial artery, and in front of subscapularis, latissimus dorsi and teres major. So these three muscles actually form the posterior wall of the axilla. So then it enters the lower triangular space accompanied by profunda brachii artery. So after that, it reaches the spiral groove. So here also it will be accompanied by profunda brachii artery. You can see this is the posterior cord and this is the radial nerve in lower triangular space. You can see here the radial nerve in lower triangular space. You can see the radial nerve in spiral groove. So then the radial nerve pierces the lateral intermuscular septum, and at the level of lateral epicondyle, the radial nerve divides into a deep branch and a superficial branch. The deep branch is passing between the two strata of the supinator muscle, and superficial branch is continuing beneath the cover of brachioradialis. You can see the superficial branch of radial nerve in relation to the anatomical snuff box. And you can see this is the distribution of the superficial branch of the radial nerve. So this is just to revise you with the overview of the course of the radial nerve. So then we'll go into the actual course. After the spiral groove, you can see, so this is the radial nerve in the spiral groove accompanied by the profunda brachii artery. So after the spiral groove, it pierces lateral intramuscular septum and enters anterior compartment. It descends between brachialis and brachioradialis and extensor carpi radialis longus. So in front of lateral epicondyle, nerve divides into superficial and deep branch. So superficial branch, it is essentially sensory. So runs downwards along the lateral aspect of front of forearm. So in front it will be covered with brachioradialis. So behind it rests on supinator, then pronator teres, flexor distal superficialis and flexor pollicis longus. So medially radial artery is related to the superficial branch of radial nerve only in the middle of the forearm. You can see here. So this is the middle of the forearm where radial artery is in relation with the superficial branch of the radial nerve. So superficial branch of radial nerve, you can see at around 7 centimeters above the wrist, it winds around the lateral surface of the radius, then descends on brachio pollicis longus, extensor pollicis longus, and extensor pollicis brevis, and appears on dorsum of hand in the roof of the anatomical snuff box. So after that, it divides into 5 dorsal distal nerves. So it supplies 2/3 of the dorsum of hand, especially the lateral 2/3, and then lateral 3.5 digits. You can see here. So actually in this diagram they have made these nerves reaching the terminal phalanx. Usually it will not be reaching the terminal phalanx, it will be only up to the middle phalanges. So terminal phalanges area will be supplied by the median nerve in lateral 3.5, and here in medial 1.5 it will be supplied by the ulnar nerve. So this is the anatomical snuff box where you can see it is bounded on the lateral side by the abductor pollicis longus and extensor pollicis brevis, and on the medial side by the extensor pollicis longus. And here you can see this is the floor. You can see the radial artery resting in the floor, and you can see the cephalic vein in the roof along with the superficial branch of radial nerve. So here superficial branch of radial nerve is not visible, so we are just highlighting the anatomical snuff box. So deep branch of radial nerve, otherwise called posterior interosseous nerve, it is essentially motor. So it winds round lateral side of the radius between superficial and deep strata of supinator. It descends between superficial and deep groove of extensor muscles of forearm. Divides into 3 short and 2 long branches. So nerve forms terminal pseudoganglion at the back of the wrist and supplies the nearby joints. So you can see here, this is the posterior interosseous nerve. You can see 1, 2, and 3 short nerves, and you can see 2 long nerves. These are the branches of posterior interosseous nerve. You can see here, this is the termination of the posterior interosseous nerve. So branches categorized into muscular, cutaneous, articular, and vascular. And we can see here branches in the axilla. Muscular branches will be branch to long head of triceps and a branch to medial head of triceps. Especially this branch is also called as ulnar collateral nerve because it accompanies the ulnar nerve. And then the cutaneous branch will be posterior cutaneous nerve of arm. Name itself speaks that it is supplying the posterior aspect of the arm. And you can see here branches in the spiral groove, muscular branches, one to the lateral head of triceps, the other to the medial head of triceps. So this is also giving articular twigs to elbow and ends by supplying anconeus. Cutaneous branches are posterior cutaneous nerve of forearm and lower lateral cutaneous nerve of the arm. Then Branches in lower part of the arm, you can see brachialis, brachioradialis, and extensor carpi radialis longus. Here this brachialis is a hybrid muscle which receives nerve supply both from the radial nerve as well as the musculocutaneous nerve. So superficial branch of radial nerve divides into 5 dorsal distal nerves, supplies lateral 2/3 of dorsum of hand and lateral 3.5 digits. And deep branch of radial nerve posterior trochanterous nerve, it is supplying extensor carpi radialis brevis, supinator, extensor distorum, extensor distemini, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, extensor indicis, and extensor carpi ulnaris. So if you observe these two pictures, here it is crutch which will be compressing the radial nerve in the axilla, crutch paralysis, and here you can see this is the Saturday night palsy scenario which is representing Saturday night palsy. So in the axilla, the nerve may be injured by so pressure of the upper end of badly fitting crutch pressing up into the armpit, so resulting in crutch palsy. Then the drunkard falling asleep with his arm over the back of a chair and resulting in Saturday night palsy. So fracture or dislocation of the upper end of the humerus. So all of this are injuring the radial nerve. The resulting condition will be the wrist stroke because all extensors are paralyzed. You can see this is a wrist stroke, but sensory loss is not much significant, only small area because of overlapping of the nerve supply like median nerve and radial